The Resident Doctors Association of Zambia's president, Dr. Brian Sampa, has been dismissed from the civil service. This follows the recent go slow by resident doctors after a failed government promise to meet their demands. Doctors say that they feel cheated after government failed to honour its promise to pay arrears and settling in allowances, gratuities and the creation of SRMO Registrar positions and the employment of more than 500 doctors. Well, the association had suspended the go-slow actually after considering the threat posed to the country by the third wave of the COVID-19 pandemic. The authorities fired Dr. Sampa for allegedly inciting his members. Well, Dr. Sampa joins us now from Zambia via Zoom. Dr. Sampa, thanks very much indeed for joining us and welcome to the program.
Thank you very much.
So, have you been fired? What is the situation?
Well, I just received a letter a few days ago that I've been dismissed from the civil service. And they cited the same problem, where we had held a go-slow for 7 days in demanding for employment of doctors, creation of positions, and the payment of personal emoluments.
All right, so what did they say you did wrong for you to be fired? You can't just fire someone.
Well, in the letter, they said I had missed work for 10 days, but that's not true, because the truth on the ground is that I've been on leave, and they knew that that's just one way of trying to intimidate so that we can't speak out, because each time we tried to push for anything, it's either they transferred me to a far place or they had to charge me. But now this time, they ran out of options and just decided to fire me.
Who's doing the firing? Is it the Minister of Health, or do you think it's coming from higher up?
Well, nothing is being done now without the knowledge of the highest officers, because the employer of all the civil servants is the president. So for me to be fired, it simply means that everyone knows in the system what's going on.
All right, so let's talk about the issues on the ground. So what have you been going through and for how long?
Well, for the past 10 years, doctors have not been getting their settling in allowances when they're employed, and other doctors had to work for more than 9 months without getting pay. When they started getting paid, they were not paid their arrears. Then there's also an issue of gratuities. Most of the doctors who are on contract, they haven't been getting their gratuities. Others are owed more than 3 gratuities. And the problem we have also is the ratio of doctor to patient in Zambia is 1 to 12,000, while the recommended one by WHO is supposed to be 1 to 1,000. So we have got a deficit of about 3,000 doctors who need to be employed. However, we haven't seen any significant employment. Meanwhile, we've got more than 500 doctors who are registered with HPCZ and are just roaming the streets. They are not employed. So these doctors have been in the streets for more than 1 year. And we feel once these are employed, it can bridge the gap and it can help to, stabilize the already strained health system. Looking at the COVID-19 third wave, which is already here with us, we're having a lot of shortages. Then we also have a problem of positions. Most of the doctors are working in administrative positions instead of substantive positions. So they are being paid as junior doctors while it's holding higher positions. So we are demanding creation of more positions so that these doctors can be motivated.
Does government have money to meet these demands? I mean, the idea that a doctor can work 9 months without pay is outrageous. But it sounds like a government that's broke, that's finding ways of not expending, or is that not the case?
Well, the truth of the matter is that money is always there, and the government has got enough money. It's just a matter of, priorities. For the past years, it has become a norm that, as doctors, they are not prioritized, knowing that they are essential workers, and they have taken advantage of that, thinking that they are not going to say anything or do anything. That's why even now, when we decided to speak out, they were quick to punish us, saying we are essential workers, we are not supposed to, speak out or go on a gossip, which is unacceptable. We do understand there is money, and it's just about priorities.
Just this week, I was speaking to the president of the Socialist Party in Zambia, and he says that the democratic space in the country has shrunk to almost zero, and that you can't voice and you can't demonstrate, you can't protest because the government is silencing voices. Is that what you're experiencing as doctors crying out for better working conditions?
Exactly that, because as I speak to you, I was even charged by the police for inciting. I had to go and be questioned by the police. And, they are using propaganda. When you look at the newspapers which are biased towards the government, there are a lot of people who are even demanding for my arrest and a lot of, unnecessary things. So we are facing a challenge because even as civil servants now, everything we say has to be politicized. The police will be involved, and the other wings of the government will be following you just to ensure that you don't come out. My license was suspended. I can't practice anymore, and they had to now touch my job, literally just trying to render me useless. However, none of these things incapacitate me as the president of the association, and I'm still the association president. So we shall continue fighting for what the doctors are owed and what is due to them. Until we get those answers, we are not going to be intimidated.
So that's the situation for doctors. Is it the same for nurses and other medical staff?
Well, when you look at the response which is coming up from what we are doing, everyone is happy because they feel their associations and unions are they are too rudimentary. They don't speak out. People are scared. There are very few people able to speak out. Even as we speak out, there are a lot of intimidations, and people are worried that the worst could happen because when people try to speak out, they are victimized, and as such, this is the general picture in the entire civil service.
Have things gotten worse under the current administration when you compare to previous years?
Well, when we look at what has been happening, things haven't really been haven't just gotten worse now, but this is a trend which has been there for some time. Like I stated, some people are owed like 10 years ago. So this is something which has been there. It's like it has just become a norm that government doesn't, is not taking these matters seriously, the payments of settling in allowances, arrears, and other things. So we decided that it was too much, and the membership felt it was the right time to fight for this. Looking at the promises which were made concerning the COVID-19, even when it came, we were told no doctors and the other health workers were going to be given incentives, but we haven't received none. So we thought, okay, instead of asking what we've already worked for and have them got it, because the economy is not really doing fine and people are suffering. So people are looking for ways in which they can survive. They need to be motivated, and they have got families. These are doctors who are also getting sick and dying of the same COVID. So they feel they need to be heard, and that's what is going to motivate them.
What does a doctor who hasn't been paid for 9 months survive on?
Well, those doctors, because I was also a victim of the same. When we started working, we had to stay for 5 months without getting paid. And we had to struggle. We had to borrow money, such that by the time you are starting to get paid, instead of paying you the arrears, they pay you for 1 month, and you have to now live in negatives. For the entire time, you are now paying credit, borrowing, and it becomes a chain. So how do you work? Because a doctor is supposed to have a free mind. Now, when you have a lot of credits, you become a slave, and you can't concentrate as you work.